So this is part 2 of my health journey that was an entire year of my life. Now, something that I want to just preference that I forgot to say in my first video is I actually work in healthcare, but I'm in finance. I do not take care of patients. You don't want me to. But I have been part of finance and healthcare for over 20 years. And the organization where I got my care, I actually worked for 17 years. And the reason why I'm saying this is I'm very familiar with how authorizations and insurance works and how to advocate. And, I do understand illnesses, not that I could ever diagnose anybody, but I have a good understanding of how the healthcare system works. And where I live, I'm very lucky where we're like the Mecca of medicine. So the treatments that I got were the best that I could get anywhere. So I just wanted to give that little caveat, I guess. So I left off on my last video when I went to the emergency room, which was on February 21st. I looked up the date. And, in the emergency room, I have kidney stones. So the whole issue was I had this one small stone, little tiny stone, that has now caused a blockage because it was blocking, not to be TMI, like my urethra. And urine was starting to build up in my kidneys. So it was not something I could pass like some people do. And it was already infected as well. So that is why I needed to be admitted. Now, also, at this time a year ago, hospitals in the area that I live in, we were running out of space. It was the surge, and inpatient beds were hard to find. And for urology procedures, believe it or not, there's typically a specific room assigned to them for the equipment. So I needed a hospital that had a urologist, a procedure room, plus an inpatient bed for me. So the ER doctor felt really bad, but I ended up getting sent to a hospital that was an hour away from where I live. But I understood. I said, that's fine. I get it. It's still part of the network. So whatever, no big deal. So I do get transferred to this hospital. And I knew once I got there, because it was so late in the day by the time they found the space and I got transported, that I wasn't going to see a specialist. So I did see a urologist the next day on February 22nd, and he explained to me the route of treatment I was going to receive. Because it was not a stone I could pass, I was going to have a procedure done to have a kidney stent put in. And the hope was to grab the stone when they did this procedure. I was like, okay. And I did have the surgery. I'm on, antibiotics, IV, and I'll never forget waking up from the surgery, because it was later in the day they squeezed me in, and I was in excruciating pain. And I remember ringing the nurse saying, I thought the whole point of this was so I wouldn't be in pain anymore. So they gave me some pain medication. I fell asleep. I woke up the next day. The pain was gone. So this is part 2. Stay tuned for part 3.